Hi, I'm Dr. Sarah Gonzalez. I've been with Kern Medical since 2012 when I did residency here. I completed my residency in emergency medicine in 2016. I'm currently the Director of Addiction Medicine, Director of Shelter Medicine, and the responsible physician for correctional medicine. Right now we're in the middle of essentially a fentanyl crisis, and so we have a lot of patients that are dying of overdose deaths. We've had almost 150 in the county so far just this year. And so there's a lot of patients with opioid use, methamphetamine use, other stimulant use that need help. We're launching a full service addiction medicine program here at Kern Medical. So it involves multiple parts. One part will be an inpatient consult service. So any patient that's admitted to the hospital has any type of substance use disorder, I would be able to help in management of their care, any age as well, adolescents, adults, newborns, any age range. In terms of how it affects the emergency department, I'll be available for any consults for patients that need help with withdrawal management or interested in getting on MAT, which is medication assisted treatment. I'll be available for all of that. In terms of our outpatient services, we're going to have a clinic called MARC, Medication Assistance and Recovery Clinic, and it will be located in A Wing. We will have clinic Tuesday and Thursdays afternoons, and we will have spots available for walk-ins. So if somebody is really struggling with a substance use, they're able to walk into clinic and we'll be able to help them. Only less than 10% of patients that have a substance use disorder, also including alcohol use, actually seek treatment. So there's a lot of patients out there that are not seeking treatment, aren't aware of treatment, or there's a lot of stigma associated with it. So there's a lot of hesitancy to come and ask for help because they feel like they're going to be judged. And that's one thing we worked very hard for with our addiction service, is we're there to treat them just like we treat any other illness, just like we treat high blood pressure or diabetes. It is a chronic disease, and so we try to make them come in and not feel judged, and that we try to eliminate the stigma, and we're there to help meet them where they're at. Currently, you will need a referral from another, like your primary care or the emergency department. We would take any insurances, but we are working on a process so that patients would be able to self-refer themselves. So essentially, they could come without a referral and prior authorization. They would be able to come to clinic, but that's a work in progress. With the more availability of fentanyl and with it being laced in other substances, we're seeing more and more accidental overdoses that can result in overdose deaths. And so it's not just being aware of, education and harm reduction for those that are using fentanyl, but also those that are using other substances. There's even situations where just even marijuana has been laced with fentanyl and somebody has an overdose. So it's much more readily available, it's in more substances, it's much more potent. Fentanyl is 100 times more potent than morphine. So I think it's trying to not categorize these people as that, they just need to quit, they just, they're doing this to themselves. That language, that rhetoric has to stop. So addiction is a chronic problem, and we here at Kern Medical are here to help you tackle this problem head on and help you in your treatment.